So once the amalgam capsule is shaken up and everything's ready to be broken open, you break the amalgam capsule into the amalgam well. All right, the amalgam well just holds the amalgam. Then you would use the amalgam carrier and you would load both sides. So the inside of the amalgam carrier is meant to hold amalgam, so you would go down like this and then scrape it against the side like this to load it up. You would do it on both sides. And then you would pass it to the dentist. While the dentist is putting the amalgam inside of the prep tooth using this method, you're getting ready with the plugger. The plugger has a waffled end. This is because the amalgam can get a little bit flaky when it starts to get worked, and so the dentist can actually press down into the amalgam with this and then pick up little bits and put it back into the tooth. So while he's plugging the tooth, what you're doing is you're reloading the amalgam carrier, right? You're doing this over and over, okay, until all of the teeth are filled up. So you do this. When he hands back the plugger, you hand him the amalgam. He puts the amalgam in the tooth. You hand him back the plugger until the tooth is all filled up. Then you might use a condenser. There's a burnisher. There's a ball burnisher, football burnisher, and an acorn burnisher. So they're just named for the shape of their ends. So the football burnisher looks like a football, the acorn looks like an acorn, and the ball burnisher looks like a ball. What this does is it packs the material in tightly while creating anatomy. Football burnisher here you see has a point on one end and it's round on the other. This would be creating the pits and the dips in the tooth and allowing the dentist to smooth out the material against the prep. So that's what the burnishers are for. So he would also next use the cutting instruments, so carving instruments. So we have an interproximal carver and a discoid cleoid. They're both sharp instruments. What their purpose is removing extra amalgam while creating anatomy. So the interproximal carver is sharp and it's meant to get out extra amalgam material interproximally in between the teeth. That's why it's flat and shaped like this. Okay? You can also call it the IPC. The discoid cleoid, which is kind of a funny word, all right, is for removing material while creating anatomy occlusally. So you can see it has two separate ends. The word oid means like, so discoid cleoid means disc-like, claw-like. So the disc-like is the round side, that's the discoid. The claw-like is the sharper end, that's the claw-like, discoid cleoid. While you're using the carving instruments, it's important that you always keep your HVE near the prep because we don't want the dentist carving amalgam into the patient's mouth. We want to make sure that we're getting it into our HVE. Afterwards, you could use sanding strips, sandpaper discs, and a mandrel with a slow-speed latch-type handpiece to smooth out the restoration, and the patient will be good.